Hi, it's Phil.
Hi, I'm Jeremy.
And we're today, for Pioneer Podiatry, going to talk to you about diabetes and how it can affect your feet. So we get a lot of patients every week who come in and sit in our clinic to see us, and they are not sure why they're there to see us. They know they've had diabetes, they know that their GP has sent them across to us, and we are here today to solve that mystery for you. So Jeremy, diabetes can cause foot problems. So what's the first thing that we check for when we see someone with diabetes?
Yeah, so first things we can check is sort of their vascular, so circulation in their foot and their legs. And I guess moving to the second thing.
Yeah, sure.
But particularly, another important thing is their nerve health. So those main two.
Yes. So every patient we see with diabetes, they're the two things that we're mostly talking about. Diabetes causes damage to the blood vessels because the high levels of blood sugar actually cause, and they speed up that atherosclerosis, which is the damage to the blood vessel walls. So that can turn into less blood flow getting down to your feet. And high blood sugar levels also can affect the nerves. So we get a condition called, as Jeremy said, neuropathy, which is when you can't feel your feet. And before it becomes a full neuropathy or full numbness, it starts as a sort of a pins and needles or a burning sensation. So this picture here is to sort of explain that sensation that our patients sometimes get.
Yeah.
So Jeremy, what's the risk if a patient has poor blood flow and poor feeling in their feet? What's a risk of them developing problems? What sort of problems will they get?
Yeah, so to put it like in a practical sense, someone who has, lack of sensation at the bottom of their foot, which means, they could step on something in their backyard, not even realize. Of course, if you get a cut or a graze to your foot, you need to take care of it. So part of that, your body does that as well. So that's through, good, healthy blood flow. If there's, lack of circulation there, that can lead to, poor healing. And like, what we use our feet for, we walk around on it.
That's right.
So unfortunately, in places such as this area, just at the ball of your feet, that's where a lot of contact comes into the ground. So that's just another extra thing your body has to kind of cope with. So lack of feeling the feet can lead to just a cascade of events such as, unfortunately, this foot here.
Yeah. So a wound like this can be pretty hard to heal, Jeremy?
Yeah.
It's prevention is better than cure. So if your GP, if your doctor gives you a care plan to come and see us, we may not have to do anything to your foot that day, but what we're able to do is assess your risk status and give you advice to manage your feet in a way that doesn't lead to this. So we actually want to prevent these sort of diabetic foot ulcers from happening, and that's our job really. If you do develop a wound, we will also be involved in helping to offload the wound and to help get you back on track. But once you've developed a wound, it's always a high risk area for developing again. So I've said it already, but prevention is better than cure. So there's certain assessments that we do. Jeremy and I are going to do a video in a couple of days on what we actually do for a patient when they come to see us. So keep an eye out for that. But otherwise, I reckon that's enough for the day.
Yep.
Yeah, awesome. Okay, see you later, everyone.
See you.